right, here we are. Excellent. Well, hi, David. How are you today?
I'm good. Catherine, how are you?
So good. Today we are here with David Stark, and David is the president and CEO of UnityPoint Health. Now, this is a role he's been in since 2018. A little bit about David. David began working at UnityPoint in 1995, and during that time, he held multiple positions, including CEO of Iowa Lutheran Hospital, president and CEO for Blank Children's Hospital, and most recently as executive vice president and COO for UnityPoint. So welcome to the show today. I guess we're on a show, right? Welcome to the interview today.
Sure, that sounds good.
Well, tell us, David, a little bit about your leadership journey. Obviously, you've been at UnityPoint Health for many years, and you obviously feel strongly about the organization. Tell us what led you to UnityPoint and your many leadership roles there.
Well, I've been very fortunate, and thank you for having me today, Catherine, to be part of this organization and, frankly, part of our greater Des Moines community, certainly including West Des Moines. It was a huge draw for us to come to a community like this. I'm a lifelong Iowan, born in a small town, and the reputation and the kind of people that we have here at UnityPoint were really the draw. I started my journey as a summer intern. I spent the summer between my first and second year of graduate school and literally fell in love with the place. All of our kids have been born here. All of our healthcare has been here, and I've been so fortunate to have nearly 25 years here at the same institution. And ironically enough, the first place my wife and I lived when we moved here during that time was in West Des Moines. So we were, that's where we started it all. So it's been a great journey. And I'm very privileged to be in the position I am now, but to be part of this wonderful organization.
Well, you mentioned that you were talking about reminiscing a little bit about the Iowa Lutheran Hospital and how that all got started. So take us back to that. That's a huge, incredible operation here in West Des Moines.
Yeah, so when we think back over 10 years ago, when we opened Methodist West Hospital, the planning for that actually began 7 or 8 years before that time. And I happened to be serving on the West Des Moines Chamber during that time and had wonderful support from the Chamber, from the business leaders, the community members, the city council. Were nothing but supportive through our whole process. That we had to get state approval through the certificate of need process to build the hospital and then design the hospital and pull it off. And so it was a labor of love during that time, but we knew that that's what was needed for West Des Moines, for the western suburbs, to be able to expand our footprint, provide access, and to really serve the community that's been part of who we are for many years. And when we plan in healthcare, we plan for decades. We don't really plan for quarters or months or even years. We plan for the long term, and that's how the design of Methodist West came into being.
Well, speaking of planning for the long term, here we are in the middle of a pandemic, COVID-19. How did you see, that unfolding and coming to fruition? I'm sure you saw it, happening, and how did you guys pivot during that time, realizing, this might actually occur in our backyard, and what did you guys have to do to prepare for that?
Yeah, nobody really saw a true pandemic coming. And I can't say that I had the foresight for that, but the planning that we've been doing regarding disasters, regarding surge planning, regarding incident command type things, we've been doing for years. And in the past, we've had things like floods and tornadoes. We've had, high capacity in winter season. So we've had practice really setting up networks and infrastructure to deal with things like supply chain, to deal with our staffing, to deal with different models of care. And so it was highly adaptable when March was coming and we knew things were going to be a lot different for us, be a lot different for our world, frankly, and our community. We implemented that incident command right away, and we're blessed to be part of a larger system that spans throughout the state and the resources that come with that. we're able to manage things quickly, whether that's changing to online appointments in our clinics that patients weren't coming in because we encourage people to stay home, or how we tested, laboratory testing, how we got personal protective equipment. We were able to pivot very quickly, and we've stayed in that incident command structure since March. And I see that continuing through the rest of the fall.
Well, here we are on August 17, and kids are going back to school. Moms and dads are probably excited yet nervous, you know, and you have 4 kids of your own. So I guess, you know, what's some advice that you give for everybody right now as school is starting up?
Well, I'm one of those concerned parents because I'm in that same boat. And the advice that you've heard so often bears repeating. And it's true for all of us, not just for our kids, but for us as well. We need to continue to wash our hands. We need to make sure we see every opportunity to social distance. Don't gather in large groups. Wear a mask when that's unavoidable, when you're out and about. And be mindful of not touching your eyes and your face. Very difficult for kids and frankly for us as adults to think about that during the day, but that's how you can transmit disease and can get sick. So if you can be safe and think those things through, and it takes work, it takes effort, those are the things that we can do to safely reopen, to safely get back to what everybody is yearning for. It's not going to be easy. It's going to be different. And that's for sure. But those are some of the things that we continue to harp on here, and I do in my own household, but to tell folks to do those things and remember to do those things on a literally everyday basis.
So you're in the medical field, you know, you're on the front lines, and thank you for all of your hard work, you and your entire teams, you know, during this really crazy time. So what, you know, what's your crystal ball? Do you have a crystal ball on when you think, you know, we might get through this, when things might be a little bit more normal? That's probably a hard question to answer, but wondering if you have some extra super duper insight for us.
Yeah, that is a tough question. Difficult to predict. What I have said to folks that have asked me that question before, I think we will be in this kind of mode of living with the pandemic. And it's not controlling us. We're living with it to be able to carry out some of those normal functions of lives, whether it's work, whether it's school, whether it's, you know, activities and so forth. We're going to have to live with it probably through the fall and into the winter. I would hope that we have a widely available vaccine early in 2021. I think that's a game changer. I think that will give a heck of a lot of confidence to folks to be able to do some of the things that maybe even now, whether that's travel or whether that's going out to eat, that we'll have a better comfort level there. But I think we'll be living with this virus, you know, for a long time to come, but most urgently through the rest of this fall and into the winter. I think this is kind of the new normal. And hopefully we create a better normal with it. But that's my best guess. And I certainly hope it's sooner than that. But everything I've read and seen, I think that's what we can expect.
Okay, I like your words, better normal, better normal. Okay, I'll take that. That's good. And a vaccine early 2021. That sounds great. Okay, we'll cross
Yep.
our fingers as well on that.
There's no shortage of work being done on it. There's literally dozens of trials out there that are happening right now. So, and we'll get more than one. I know we'll get more than one vaccine, and that's something to look forward to.
Very nice. So you're a leader in one of our most highly valued medical institutions in West Des Moines. What are some of your words of wisdom, leadership advice right now for other leaders in the community and outside the community?
I think for leaders, one of the things that I try and espouse to is a level of transparency. Things are tough. I mean, think about the pandemic. Think about the storm we just had this past week. Think about the economy, all the civil unrest. People know that things are tough. Don't sugarcoat it. Be transparent about what you're doing, and with that comes a level of authenticity. People want to see as leaders that you're human, that you're able to feel the things that are happening and understand the challenges that people are going through and empathize with them. And through that is a high amount of communication, both in written and verbal, and visibility. I think those are some of the key traits that I would encourage other leaders to do, that I try and espouse to, that really help your workforce, your team members, but ultimately your community, knowing what's going on and that they can count on you to be there through thick and through thin.
I love that. That's great advice. So what is your favorite thing about West Des Moines? It might be hard to pick a favorite, but what are some of your favorite things about West Des Moines?
Yeah, some of the favorite things. I tell you, the ability of West Des Moines to grow like it's done in a very thoughtful way over years. I've had the vantage point of watching this for over 2 decades. And the ability to grow in not just Polk County, but Dallas County and Warren County, and to continue to promote the smart development of business. I have great trust and confidence in the mayor, in the city council, the city planners. That's one of the best things about, I think, West Des Moines, is how smartly they have gone about the growth and development of the city. And not only the infrastructure, things like having healthcare and good police coverage and fire and water and all of that, but boy, the business-friendly environment that is West Des Moines, and the ease of getting around and how well it's coordinated, that's probably one of my favorite things about West Des Moines.
Yeah, when we asked Dan Houston, a principal, that same question, yeah, he was saying that as well. Very planful, clearly well planned out community, and incredible. So, so it sounds like you have 4 children, and tell us how they're dealing with this new world that we're navigating right now. How are you and your family dealing with all this?
Well, since March, it's been a lot of together time. And 2 of our kids are in college. They're off to college now, and the other 2 are in high school. And we'll be starting here in another week. What we found is with them, they've had to adapt to kind of the different social norm, not getting together as much with their friends, not seeing them in school or in activities and that sort of thing. It's been difficult because so much of our children's growth and development is related to that social network that they have, and adopting to new ways. They've always been good with technology. So whether that's, Instagram or Snapchat, TikToks, whatever, they're good at that. But it's that individual development that is so important to still connect with those friends and connect with those things that are most important, which we've tried to stress. But it's been tough on them. I mean, they're used to going to school, and we're used to having them go to school in the spring, and the summer of it looked different this summer, and so far in the fall we're getting back to some level of normal. We hope it continues that way, but it's been a challenge. But in the other hand, it's been kind of fun too, to have everybody under the roof and going for walks as a family and things like that have been good.
Yeah, there are advantages, right? There are pros and cons to everything. So yeah, that closeness time that you get is truly special for sure. Well, we appreciate your time, David, so much, and spending time with us and imparting your amazing words of wisdom. So this is the West Des Moines Chamber's brand new CEO Insight series that we started during COVID, and we're just so happy that you're here to join us today. So
thanks for having me.
Enjoy your afternoon.
All right, you too.
Thanks, David.
All right, bye.